All right, so we're going to cover anatomy today. I know we covered some of this last year for those of you that were there. So a little review today, and then I guess the goal is to have a good foundation for the upcoming weeks when you're going to be going over some conformation and lameness and other issues that are all related to anatomy. So we're going to go through this presentation here. I do have a video at the end, depending on how much time we have and if I can get it to play, or if not, you guys can play it on your own. Any questions or anything before we get started? Everybody's muted. Excellent. Feel free to unmute and ask questions as we go. If you have any questions, I'm going to do my best to figure out how to Zoom. I have two different computers here, so I'm going to be looking sideways sometimes. Sorry. All right, so the first thing we're going to go over is our forelimb anatomy. We're going to start with bones, and then we're going to move on to tendon, ligaments, and soft tissue structures and other things. Again, if you guys have questions, feel free to just pop in and talk. No worries there. So our forelimb. So these are the bones of the forelimb. Everybody remember those? I can see you all shaking your heads at home. Sure. All right, so starting with the front leg, we're going to start way at the bottom and work our way up and go through all of our bones. So our first one here is our third phalanx, or our coffin bone, also known as P3. So I think the biggest confusion sometimes comes with things having more than one name. So oftentimes there's going to be an anatomical term or a veterinary name for things. And then there's going to be more of a layperson's name for things. So can anybody tell me what the term phalanx means? Susie?
I can't, no.
All right, how about Greg, since you're there too?
Yeah, definitely. It has something to do with the bone.
A type of bone. So when we're talking about the lower limb of horses, if this were a human's hand, what would this be equivalent to? The last three bones are like your what?
The finger.
Your finger. Excellent. Thank you, Emmy. So phalanx or finger is what you may know that term as. So just like your finger has different segments, our lower leg of the horse, whether it's front leg or back leg, is going to have phalanx or phalanges. You may have heard that term. So the third one is actually the one that contacts the ground. And if this were our hand, which finger would it be?
The middle finger.
Excellent. Everybody remembers that one. So the horse stands on their third digit or their middle finger. And so if you imagine this is your middle finger, what is the hoof wall equivalent to? Anybody?
Fingernail.
Your fingernail. Excellent. So the hoof wall is kind of like your fingernail, and under that fingernail is your P3 or third phalanx. In the horse, we're going to call it the coffin bone, and we think of it like that bone is encapsulated in a coffin of being the hoof capsule. All right, so that's our P3. The little bone that lies behind it then is that navicular bone, also known as the distal sesamoid. So when we use a term like distal, what does that mean? Anybody?
Doesn't it mean that it's like not connected to ligaments?
Not necessarily. So we've got two terms that are kind of opposing each other. We have distal and proximal. So when we're going to talk about the sesamoids, we have sesamoids that are distal and we have sesamoids that are proximal. So the proximal sesamoids you can see in this picture as well, but they're not pointed out. All right, so they're going to be up by that fetlock joint. So the distal ones, the distal sesamoid is going to be further away. So distal basically means further from the body, whereas proximal is going to refer to closer to the body. Does that make sense? All right, so our distal sesamoid is going to be our navicular bone. So it's further away from the main part of the body than the proximal sesamoids. All right, so moving up, then we're going to get to our second phalanx or phalange, or our short pastern. All right, so part of that bone is going to be encapsulated in that hoof capsule, and part of it's going to be above. Those two bones, P2 and P3, create a joint. Who can tell me the name of that joint? Callie, do you know what that joint is called?
No, I don't.
The fetlock?
Nope. So all the way at the bottom, kind of almost, most of it's actually encapsulated in that hoof capsule between P3 and P2. Anybody else want to take
The coffin joint.
Excellent. The coffin joint. So it's in that hoof capsule. So the coffin joint is going to be the joint space between P3 and P2. All right, so moving up from P2, then we have the long pastern, also known as P1. So that's that longer bone there. And so the joint made between P1 and P2 is going to be what? What's that middle joint called there?
Pastern.
Excellent, Emmy, pastern. So that's our pastern joint. All right, and then when we move up from there, we see those two sesamoid bones up top. In this view, you only see one, but our proximal sesamoids are going to sit behind what big joint there at the top?
Fetlock.
Perfect. That's going to be your fetlock joint. Excellent. So our next picture here are actually two radiographs. So just looking at our anatomy in different ways. So these are x-rays, and you can see your coffin bone at the, so when we're looking at the right-hand picture, you've got your coffin bone at the bottom, your navicular bone sitting behind it, P2 being your short pastern, and P1 being your long pastern there. The picture on your left-hand side is a picture of what bone?
The coffin bone.
You do see the coffin bone in that picture, but what bone is outlined in yellow?
Navicular.
Excellent. That is your navicular bone. And if you use your detective skills, at the top of that screen, it says right fore navicular skyline. So that picture is actually taken from the back of the hoof up top, almost kind of taking our x-ray from the fetlock and then looking down on that navicular bone. So you get a very different view of that bone where you're able to see the vascular channels in it. Those are the little black dots on the inside. The coffin bone is in that picture, kind of making that semicircle of that bone on either side of the navicular bone. But the one in yellow is going to be your navicular. Does that make sense? Shaking heads, yes, excellent. All right, our joints. So we went over these. So our coffin joint is going to be our bottommost joint, then our pastern, and then our fetlock. Why are these important? When you guys get to your next couple sessions, you're going to be talking about anatomy, or I'm sorry, conformation and lameness. And we're going to start talking about diseases that affect these joints. So if we're talking about low ring bone, that's going to be in that coffin joint. And if we're talking about high ring bone, that's going to be in your pastern joint. All right, so these are those two proximal sesamoid bones. So the picture on your left is a lateral view. So if we're looking from the side of the horse, That's what creates that outpouching of the back of that lock. And then the picture on the right, again, radiographs, are going to be views of the two proximal sesamoids. So there's two bones at the top and only one distal one. So there's what we call a medial and a lateral sesamoid bone. All right, so the term medial, what does that refer to? Anybody?
Doesn't it mean it's like towards the middle of the horse? So that would be the one on the inside.
Excellent. So medial is towards midline or the one on the inside. So then lateral must be what?
The one on the outside.
Excellent. So we've got one on the outside and one on the inside. So very important because horses have 4 legs that we need to be very specific oftentimes when we're referring to what is affected. So is it the front leg or the back leg? Is it the left leg or the right leg? Is it the medial bone or the lateral bone? And that will help us know exactly what is the problem and what we're worried about, maybe what we're treating in veterinary medicine. All right, any questions on those bones? All right, silence is agreement. All right, so moving up the leg, so we're going to get to our metacarpal bones. So in the front leg, we're going to refer to the cannon bone as our third metacarpal. Why our third? Anybody know?
The splint bones make up other metacarpals.
Sure. So the third metacarpal is equivalent to that middle finger. So that third bone, which is the one, if you look at down at your hand, is going to be this one right down the center. So your phalange is here, your finger, if you look at me and my screen. So your third finger here, and then your metacarpal is actually what makes up kind of the palm of your hand. So that third one comes down the center. The 2 splint bones are going to be on either side of that. MC2, or the medial splint bone, is on the inside. And your MC4, or your lateral splint bone, is going to be on the outside or the lateral side. All right. So we have basically 3 of those bones present when we go up the leg. The rest of those phalanges evolutionarily have gone away, unlike our fingers that, or our hands that still have 5 phalanges. So as we're looking at this leg, we call it as lay people the cannon bone, right? But when we're referring to anatomically, we can call it metacarpal 3. And what does carpal refer to?
The wrist area.
Excellent. So in a human, it's going to be equivalent to our wrist. And in the horse, what do we call that joint above? So, oh, hang on, technical difficulties. All right, so our carpus is our wrist. Do you guys know the layman's term for this joint in the horse? What do you guys call this part of your horse?
The
The
knee.
knee.
Excellent, the knee. All right, so the horse's knee is in their front, unlike us, and that's going to be our carpus. I'm going to go backwards for a second here. So when we look from the back side, you can see on the left-hand side, those 2 splint bones coming down. And then on your right-hand view, we also have a ligament in there that we're going to talk about at the end here, but that is your interosseous ligament. And so there's a small little ligament that connects those 2 splint bones to the cannon bone. So they're quite tight. There's really not a true space in between them. All right, so as we move up, we get to our carpus. Many carpal bones in there that make up that carpal joint. And you can see those on X-ray there. So the one on your left is a front to back view, and the one on your right is going to be a side view. So in that side view, you get that bone that sticks out the back of that joint. And that actually creates a little canal for all of our ligaments to run through. It's the way, you know, evolutionarily their ligaments are protected by having that little bony covering to keep them safe. So here's all the names of the carpal bones. I don't think you guys need to know these in detail, but just so you know, there are 2 rows of carpal bones. So that makes 3 different actual joint spaces within the carpus. So, you know, when we get to more diseases and treating diseases in veterinary medicine, we oftentimes need to know very specifically which bone is affected or which joint space is affected. But there are 3 different pouches, basically to that carpus or knee joint. All right, so as we move up the leg, then we get to our radius and ulna. So in people, your radius and ulna are 2 separate bones all the way down your forearm. In our horse, our ulna is going to be fused to that radius. So you can see it kind of almost blends in and forms into one bone down towards the bottom. But at the top, we do have a little bit of separation between those 2 bones. So as that ulna comes up, it creates that little outcropping at the top. And what joint do we call this? Anybody know what joint is in this picture here on the radiograph?
The hock.
We're in the front leg though.
The
So-
elbow.
The elbow.
Excellent. The elbow. So this is the horse's elbow joint. So similar to your elbow joint there. So they've got those 2 bones that come together. And then there's a big bone coming off the top on that x-ray. What bone is that there?
It's the olecranon. I know I didn't say it right.
So the olecranon is the top portion of that elbow. So the very pointy part all the way to the left of your screen. I don't know. Can you see my mouse if I move it? I don't know that you can. Here, can you see my mouse there?
Yes.
So, okay, excellent. So this is your olecranon there, the point of the elbow. This bone here that comes off and goes forward, what bone is this? If you hit it, you might chuckle.
Humerus.
Excellent, humerus. All right, so our next bone there is our humerus. So at the bottom part of that humerus, you get your elbow joint, and then at the top part of that humerus, you get your shoulder joint or your point of your shoulder in our, you know, anatomical terms. So here is your shoulder joint up here and your elbow joint down low. All right, why is this important? Because when we get to conformation, we're going to be talking about angles and how those play a role in to how a horse moves and what you know, disciplines they might be suited for. So our last bone on the top there then is going to be our scapula or our shoulder blade. And so that's going to be this big bone up top. Oftentimes, if you've got a skinny horse, you're going to be able to feel this spine of the scapula here, which is the center portion. There's big muscles on either side. So if your horse is really muscular, like this quarter horse here, you're probably not going to be able to feel that. But if you've got a thoroughbred, you probably can feel the spine of that scapula there. All right, so we start to worry about saddle fit later on with where that shoulder blade sits back here, because that's going to come right below your withers. I clicked, sorry. So that's going to come right here and certainly can interfere with some saddle fitting issues. So that's your shoulder blade there, and it makes up this angle that's going to be very important later on. All right, any questions about the front limb before we move on to the back limb? I'll take that as a no. All right, so moving on to the hind limb. So we're going to go same thing from the bottom up on the hind limb. However, all of our phalanges are the same. So when we're taking x-rays, we have to be really careful to label them because they look exactly the same. So we have a coffin bone, a P2 and a P3. I'm sorry, a coffin bone, a P2 and a P1 in our hind leg just as well. And then our cannon bone really does look the same, but we call it something different. So what do we call the cannon bone of a hind limb?
Metatarsal.
Excellent, the metatarsal bone. And why metatarsal and not metacarpal? Anybody?
It's kind of how your fingers and your toes have different names. At least that's how I remember it.
Excellent. So when we get to the hind leg, we're going to call this joint the hock instead of the knee or the carpus. So basically, wrong way. Meta kind of means below, anatomically, or beneath. So this is the bone that comes under or below the tarsus. All right, so we're gonna have those same two splint bones, but they're gonna be called metatarsal bones instead of metacarpal bones. So metatarsal 2 and metatarsal 4 are gonna go right next to that metatarsal 3 or hind limb cannon. All right, so you can kind of see those in different angles on that screen there. All right, so when we get above that bone, so we've got that third metatarsus down low here, and then we're going to get into this whole thing you guys are going to call the hock. All right, just like in our carpus, we've got lots of little bones in the middle. Again, I don't think you need to remember all of these little bones, just know that they are there and that we've got multiple joints within this hock that could have potential for problems. All right, so we've got a couple bigger bones, so lots of little ones down here. Our bigger one in the middle here is our talus, and our bigger one back here is our calcaneus. So kind of similar to the front leg, but a little bit different. So this in a person, anybody know what joint this is in your body? Callie, what joint is this?
Wouldn't that be your knee?
Nope, it's going to be one below that.
Ankle.
Excellent. So this is your ankle. So the calcaneus is equivalent to what part of your body, Greg? You still there, Greg?
Yeah.
All right. So if this joint is our ankle, what's this bone sticking out the back?
A bone.
Excellent. Anybody want to help him?
Like your heel?
Excellent, Emmy. So that is your heel. So that would, the horse's heel sticks straight up in the air, whereas our heel points out backwards. So if you think anatomically, your metatarsals kind of go across the arch of your foot, and then that heel bone sticks out the back. So this is your calcaneus. Later on, we're going to talk about some ligaments, and those ligaments are going to run right over the backside of that calcaneus. So your Achilles tendon and all of that would run right up here. All right. So this whole joint here is called the hock or the tarsus. There are 4 joint spaces that we typically refer to. And when we're talking about treating diseases of the hock joint, we oftentimes treat them separately by different injections into these joint spaces. All right, so moving up from that hock joint, the bottom part of this bone here attaches to that hock, and the top part up here to the joint above. So this big long bone here, what's that called? The big one.
Femur?
Oh, we're one below that. We're not quite there yet. Sorry. So we're looking at this bone right here. So this is the tibia. So basically the long part of your leg below your knee. So from your knee to your ankle is the tibia. All right, so in the horse, the tibia bears basically all of the weight. And then we have this tiny little spicule of a bone over here. What's that called?
Fibula.
Excellent. You guys can read well. So that is your fibula. All right. So in the horse, it's really not a weight-bearing bone. You can see how small it is. It's there, but it doesn't do a whole lot of work. All right. So the tibia is going to bear the majority of the weight in this back end. So this bone down here in this radiograph is the tibia. This tiny little bone over here is your fibula. All right, or the horse's fibula, I should say. And then up here we have this big joint. What's that joint called?
Would it be the stifle?
Excellent. So now we are up to the stifle. So the stifle is basically the equivalent to what joint in you?
Your knee.
Excellent. So this is the human equivalent of a knee. All right. So it has this big bone here in your right view or right x-ray. What bone is this up front here?
Patella.
Excellent. Patella or your kneecap. Unfortunately, we don't call it the knee in the horse because in the horse, the knee's in the front. But your kneecap is your patella, and this is your horse's patella. So it's going to sit on top of this stifle joint. So you've got your tibia down low, you've got your patella out front, and then this big bone here. What's that big bone of the upper thigh of the horse?
The femur.
Awesome. So that is your femur. All right. So when we look at another view here, you've got that femur coming back this way. Of course, this one's the opposite direction. So this horse is facing to the left. You've got your patella or the equivalent of your kneecap here out front, your stifle joint here. So femur comes up and creates this joint up high. What joint is that? Anybody know the joint, the big ball and socket of the femur?
It's your hip.
Awesome. So that is their hip. So veterinary term for that is coxofemoral. So coxo referring to the part of the pelvis and femoral referring to the femur. So that's your hip joint there. So then this large bone that it connects to is what?
Pelvis.
Excellent. So that is their pelvis. So lots of different parts of the pelvis. I don't think you guys need to know all of them, but at the back of the horse, when you're doing your terms of kind of like the outer parts of the horse, this is going to make the point of your buttock here. So that bone, pelvic bone at the back. This is going to be your coxofemoral joint or hip joint in the middle. Your pelvis is going to come up. And so this is the spine coming down the center line of the horse. And it creates a joint here with the pelvis. Anybody know what this joint is called?
Sacral.
Excellent. So sacroiliac joint. So sacrum is the part of the spine and iliac is the part of the pelvis. So you've got your SI joint. So you'll hear of horses getting their SI joints injected. They're getting injected down in here. And so that's where the pelvis connects to the spine or the sacrum. So that's going to be your SI joint. All right, so if we look at the outer surface of the horse on your left-hand side, the hip joint is actually all the way back here, but the point of the hip we call up here. So when we look anatomically, this is going to be your point of the hip. And on a skinny horse, you can actually palpate this. On a horse that's very well fleshed, these are a little bit harder to feel. But always helpful to get kind of the skin and muscle covering back on there so we can see what we're looking at. And then where I pointed out that point of the buttock is going to be back here. So you can, again, feel that on a skinny horse. Too many clicks. But not necessarily kind of a fat horse, but you can kind of even feel that bone. All right. So again, when you guys get to your next couple sessions, you're going to be covering angles and how these bones play a role when we talk about conformation. You know, your horses that are sickle hocked, standing under, cow hocked, all have to do with these angles. And again, it's going to help you determine if this horse is going to be athletic as a jumper or as a dressage prospect or whatever you're trying to do with them. So we'll save that for later discussions. All right, any questions on any of that hind limb anatomy? All right, I'm gonna go with no. So this is another view. Now we're kind of starting back at the bottom again, and we're gonna go over some of our hoof wall anatomy. So we've already covered the bones down the center. As those bones basically connect to soft tissue, we've got our insensitive lamina here as our hoof wall, and then we've got our sensitive lamina here that connect us to our coffin bone. As we get towards our HB, we're going to get more specific into all of that sensitive lamina and how that kind of Velcro action works to hook that coffin bone to that hoof wall. I've got some good anatomical specimens that hopefully one day we can get together in person and we can look at some of these in real life and kind of get a better idea as to kind of how all of this anatomy fits together. So, you know, remember that coronary band is that outer surface of where that hoof wall connects to our skin, and all of it kind of goes right over top of this coffin joint here. Your navicular bone is all within that hoof capsule, so there's no way to get to it other than going through the heels. Again, when we're talking about navicular disease, that can be important of what can we do to help treat some of these problems that we see in horses. All right, anybody know what this tendon is that's coming down here and hooking to the coffin bone?
Deep digital flexor tendon.
Awesome. Good job. All right. So that deep digital is what's going to hold that coffin bone and pull it backwards as that horse moves forward. Hopefully your horse has a nice big digital cushion. What does that help with? You're not so quick to answer this time. So anybody know what's the function of the digital cushion in the foot?
Doesn't it kind of just add cushion and support and help prevent inflammation with the deep digital flexor as it moves around the bones?
Awesome. So it is exactly what it says. It's a cushion to the digit. So it provides protection from concussion. So concussion we'll get when that hoof is pounding on the ground. So if you guys are galloping across cross country or you've got a horse trotting down the pavement, the better the digital cushion, the less problems they're going to have with their feet. Think about running with a good pair of tennis shoes versus trying to run in a pair of high heels. All right, so if you've got really nice cushy tennis shoes, your feet are going to feel a whole lot happier than if you're barefoot or running in a shoe that's really hard. So that digital cushion is very important for providing that concussion and shock absorption protection. It also helps with our frog anatomy. So our frog is here at the bottom. What's the main function of the frog?
It acts as a pump.
Excellent. So it doesn't rivet, but it's supposed to pump the blood back up the leg. So as that horse puts weight down on here, the digital cushion absorbs the shock, and then the frog can help pump the blood back up that horse's leg. So we're at this point, we're a long ways from the heart, and we've got this very heavy hoof wall that's kind of restricting where things can go. So that frog is supposed to be soft and flexible so that it can help kind of reflex pump that blood back up the leg. All right, so as we move to the bottom of the hoof, so you see that central frog area here. And so we like to see a nice healthy frog on these horses. And ideally that frog should contact the ground to help with that mechanical action of pumping the blood back up the leg. All right, on either side of that frog, we're going to have our clefts. So we'll have a medial one on the inside and a lateral one on the outside. You'll have this little ridge here of your sole that forms the bar of the foot. And as we have our hoof wall here on the outside, we can name our structure. So if we're at the toe, we're at the front. If we're at the quarter, we're kind of off the side. And then we get back here towards our heels. Again, when we start talking about diseases, you can talk about corns and other things that have problems that happen in that hoof wall there. That way, you know, knowing your anatomy will help you when you get to your diseases as to where those are occurring. So our sole here kind of makes up the whole central area. And how do we want our sole to look? If we pick up our horse's foot, or if that horse's foot is standing on the ground, how should that sole be? Or should not be? Anybody have an idea?
It should be firm. If it's soft, then it probably has thrush.
Excellent. So we definitely want a firm sole. Do we want it to be flat?
It should almost have like a little bit of an arch, kind of like people have a little bit of an arch. If not, they'll just chip a lot and have a lot of concussion.
Excellent. So we call that concavity. So we want it to be concave. So it should basically bend inwards. It should create a little cup or a bowl. When you pick your horse's foot up, think of picking your horse's foot out. It kind of, that's why stuff accumulates in there, right? Because it's concave. If it's flat, that could make, that could be a concern that this anatomy is not correct. So it should basically have this curvature to it. And so we call that a concave sole. If we have a convex sole, that means the sole protrudes outward or it has more contact with the ground than the hoof wall. And a convex sole tells us that there's something wrong in here and that's not normal. And that horse is probably uncomfortable and lame because of it. So if we have a good concave sole, that means we have good, likely means we have good anatomy underneath it. All right, so sole concavity would be the term I apply to that. All right, so then as we get to the back of the foot, we get to the bulbs of the heel, very important sensitive structures, and we'll talk about the bulbs of the heel when you talk about problems like overreaching and forging, where they're hitting those areas. All right, any questions on the foot at this point? All right, so moving on to the soft tissue structures of the legs. So first thing we're going to talk about are ligaments. So ligaments are going to be a short band of tough, flexible, fibrous connective tissue. So a ligament is going to connect bones to bone or bones to cartilage. So we're gonna have multiples of these that hold our joints together. And then we're gonna have some that help hold our lower leg together. So can anybody name me a ligament in the horse?
The plantar ligament.
Okay, so in the hind limb, excellent. Any others?
Suspensory.
Awesome. So suspensory ligament is probably the primary one we think of. Anybody know what number that is in this picture? Who wants to take a guess?
Number 3.
Number 3. Number 3 is incorrect.
Number 4.
Number 4, excellent. So number 4 is your suspensory ligament there. All right, so it's going to be the one that's closest to your coffin bone here. So it actually attaches to the back of the carpus or tarsus and then extends down behind the cannon bone. And then anybody know where it inserts or attaches to down low? So there's 2 places. So one is going to be right here. So we already said a ligament attaches bone to bone, right? So what bone is here that it could attach to?
The proximal sesamoids.
Awesome. So the suspensory ligament attaches to your proximal sesamoids, and then it has a band right here that goes across the front and attaches to this bone here. What's that little bone there?
Navicular.
No, not this big bone here, and not the bone that's in the hook wall, but this one here.
P2.
Awesome. So P2. So your branches of your suspensory are going to kind of wrap around the front of that pastern and attach to P2 here. All right. So that's our suspensory ligament. All right. So if our ligaments attach bone to bone, what do our tendons attach to?
To joints.
Nope. So
Muscles.
what's that?
Muscle to muscle.
Not muscle to muscle.
Muscle to
Muscle to
bone.
bone.
Excellent. So muscle to bone. So our tendons are going to be our other things at the back of the leg. Anatomically, they look very much like a ligament. So they're also collagen. Tendons and ligaments are very similar in that they've got lots of little fibers all running together that make up this larger structure. So think of a really thick yarn. There's lots of little fibers within that piece of yarn. And if you had just one little fiber, it's not very strong. But if you put a lot of little fibers together, like in a rope, now you get this big, strong structure. All right, so we can start all the way down at the collagen molecule here, and we start adding them together and stringing them together and bundling them all together, and we get all of these big bundles connected together with some connective tissue, and we create this really strong structure. So I like to think of it as a really strong rubber band because they are flexible, but they are kind of elastic. So they're able to lengthen and shorten, and you can create tension with them like you can with a rubber band. All right. So we've got lots of them, and there's a couple different pictures here that we can look at different ways that these tendons and ligaments attach to the bone. And as you get further along, it's very important to remember where some of these tendons attach to, because it can be very helpful in determining what's wrong with the horse or different diseases or problems with them. So we've got those bony structures, and then we've got these tendons and ligaments that run down the back of their leg, and I guess also down the front of their leg. There's a lot that we're not going to talk about, and those are going to be the ligaments that hold the actual joints together. So we're going to have a lot of what we call collateral ligaments or ligaments on the side of those joints that keep them in place. But we're going to focus on the big ones. All right. So this first one that we talked about was that suspensory ligament. So that runs down the back side of the cannon bone, attaching the carpus or the tarsus to the proximal sesamoids, and then extending down towards P2. They're all going to kind of join together because in the end, they all work together for locomotion. So on the front side, we have our extensor tendons. And why are they called extensor tendons? What does extensor mean?
They extend the joint, the limb.
Excellent. So those tendons help to extend the limb. So extending means opening up the joints. And so when that horse is in motion, think of it as taking that foot forward. So this one tiny little extensor tendon is responsible for taking that leg and putting it out in front of them. All right, so it doesn't take a lot because basically we only have to move the weight of the leg. So the extensor tendon, when they are standing, isn't involved in weight bearing, it's just involved in motion. Whereas everything on the back side here is going to be involved in weight bearing. So these are much more important for that standing horse, whereas this is important for that active horse. All right, so we've got the suspensory ligament here. Which one runs down the center here? Anybody know the name of this one? It comes and inserts all the way down here. What's the name of this tendon?
The
Susie?
deep digital flexor tendon.
Excellent. So that's your deep digital flexor tendon. So the name deep, it's on the inside. So it's deep to the skin. All right. It flexes the digit. So as this tendon tightens, this bone comes backwards and it creates that whole limb in flexion. All right. What's this one then on the outside?
Superficial digital flexor tendon.
Excellent. I like your reading. So that is your superficial digital flexor tendon. So it's on the outer surface closer to the skin. All right. It flexes from P2 and up. So these tendons and ligaments all work together to create flexion of that limb. If we have just one tendon that's affected, the horse by either a laceration or a problem, we can start to figure it out by knowing where these tendons insert or attach to. So if the toe is flipped upwards, I know that this tendon must not be working. So if I have a horse that's standing on its heel and its toes in the air, I can tell that somebody or something must have happened to that deep digital flexor tendon. All right, so this is a little bit more simplistic view of the ones we're most worried about. All right, so you've got your suspensory ligament here because it's all connecting bone. There's no muscle involved. You've got your deep digital flexor that comes from way up here where it's connected to muscles, comes down, creates this tendon, and then inserts on P3. And then you've got your superficial digital flexor on the outside that comes across your fetlock and inserts on P2 here. Oops, sorry. I clicked too much. All right, so we also have a couple little extras in here. So there's an extra ligament in here that attaches this deep digital flexor tendon back to the back of your cannon bone. Do you guys know what this little ligament is called? Anybody's horse ever had a problem with that ligament? Anybody know what those little ligaments are called that connect the bone over to the tendons?
The check ligament.
Awesome. So that is your check ligament. All right. So it's a little ligament that basically holds this tendon in check. So basically this tendon starts way up here as muscle, turns into tendon, and goes all the way to the bottom. So it's almost like a little tether to keep it from running away. So it holds it tight. Occasionally, if we have a problem with the horse's conformation, we can actually cut the check ligaments to help relieve some tension. So if we have a really club-footed horse, that would be a procedure we could do to help basically lower that bone. All right, so that's your distal check ligament here. There's also a proximal check ligament that's up above the carpus as well. All right, so this image is actually of an ultrasound of these ligaments. So if your horse and tendons and ligaments. So if your horse ever has an issue where they pull a tendon, bow a tendon, as we're going to talk about later, as a veterinarian, we're going to ultrasound those structures and try to figure out what's wrong with them. So over here in black and white are these different tendons and ligaments. So this one up top here is that superficial. So you've got your skin overlying here, and these are all kind of in cross section going across. So if we've got skin on the outside or the top here, we've got bone, which is the back side of your cannon bone here down at the bottom. And then in the middle, you're going to have your superficial digital flexor tendon closest to the skin, your deep digital flexor tendon deep to that. You're going to have your check ligament that tethers that ligament in, and then your suspensory ligament here hiding right behind your cannon bone. All right, so these get a little bit more difficult to look at, but we can look at them in cross section, or we can look at them linearly or long ways. And so long ways, we like to see them nice and straight and tight bands, like a rubber band that hasn't been stretched too much. And then you get this horse here that has a big hole or a tear in that superficial digital flexor tendon. And you see that as this kind of black hole here where we have no tendon holding up anymore. And then as that tendon starts to heal, you start to see it filling back in. So if your horse ever has a tendon injury, you'll be going through a rehab program to be getting that tendon kind of back to normal. So just a little bit of pictures here so you can see how those tendons look on ultrasound. Any questions on any of the stuff we covered this evening? Anybody?
No.
What were the different check ligaments?
So you're going to have your, what we call our superior check ligament, which is the one that's proximal. And then your distal check ligament, that's going to be between your kind of your carpus or your tarsus and your deep digital flexor tendon. All right, there's a really cool anatomy video. I'm not sure if I can make it play on my computer, but I can try. It's actually a very long video, but the portion of it that's relevant is fairly short. I just have to figure out if I can figure out how to get it to play. If not, you guys can play it at home. I might need technical assistance to do it.
Yeah, I'm not sure how to play the video, but you can pop the link in the chat. Can you? Or send it to me and we'll put it in the email.
I can certainly do that. Any other questions? Anything else we need to go over? So this is actually a video of race horses that, I can't figure out how to undo this. Is that working?
We're not hearing the sound on it.
Okay.
There it's kind of going. I don't know, it's not real loud.
I'll figure out how to put it in the chat and you guys can watch it tonight. It's kind of a neat video. They go through the anatomy of a racehorse. They talk about some of the different features of basically anatomy, and they actually go through a dissection where they take a leg and then they put it under force and kind of show you the mechanics of the tendons and ligaments. So I think it's like a 45-minute video, but the first 15 minutes are really what's interesting. So I'll figure out how to get it in the chat here for you guys. All right, any other questions before we go?
Silence means no questions, I guess. I think you're on mute.
All right, I think I put that link in the chat.
Okay, I got it. So you guys copy that and then you can watch it, but I'll also put it in the email when I send it out.
Perfect.
So thank you. That was awesome.
Excellent.
I think that gives us a good place to jump off from, and we'll go from there.
Excellent.
So,
you're very welcome. If you guys have any questions, feel free to email me.
yeah. All right. Thank
All
you.
right. Bye, guys.